The U.S. Congress recently held an open hearing to assess the COVID-19 outbreak. Epidemiologists and experts attending the hearing called for realistic policies and global collaboration, stressing the need for consensus on what data to share and what rules to follow. Among the epidemiologists is Dr. Jennifer Huang Bouey, a senior policy researcher and Tang Chair in China Policy Studies at RAND Corporation. In our exclusive interview, she mentioned and emphasized the epidemic is a battle between humans and viruses, not between people or countries. And now is the time for collaboration in our response together. Let's listen in. Welcome to our program, Jennifer. Tell us more about the latest situation in the United States. I see you are in red. Obviously, you're trying to express best wishes for this fight against the coronavirus worldwide.
Certainly, yeah. Red is my favorite color, so that's why I'm wearing red.
Thank you.
Also, certainly, this is, I hope, the best for all the Chinese people for the Chinese New Year.
What do you make of the measures being taken by the U.S. side in terms of protecting its own citizens against the virus?
Yeah, I think it's unprecedented. The travel ban that has been announced a couple of weeks ago, I think in a way they're showing that the U.S. CDC really trying their best, try to contain the virus spreading in the United States. Yeah.
Some have been suggesting whether there have been some overreactions. Others say, well, as much as we know now about the virus, it's better to be precautious as much as possible. So what's your take as a scholar in the field?
Well, I think every measure has its price. I think if I'm only considering from the public health perspective, yes, social distancing, given that there's no effective vaccine and there's no targeted treatment, social distancing is the only way to protect the population from a pandemic. However, I think whether it's travel ban or quarantine, it also has the price of economic price, social price. So there are people that are sacrificing because of all these measures. So we usually think, you have to be very careful when implementing these policies. And also sometimes it's giving people a false security that they feel that, okay, there's a travel ban, then the disease will not come into this country. That is not true, because even with a travel ban, a epidemic like this will be trickling in. It may slow down a little bit, but I don't think the travel ban itself can really protect the United States.
Now, some been suggesting that as long as China hold on to the front line of fight against this novel coronavirus, it's very unlikely that the other countries have to fight a big battle. Your take?
Again, it depends on what kind of epidemic we are facing. I think this novel coronavirus is highly contagious. So we already seen that cases are going up in many countries. Some of the countries already having the local community transmission. So I think for the virus like this to be contained in one area is probably not very likely to happen, even though we hope that will happen. I think what China has done with the quarantine and right now with many countries' travel ban, I think what we hope to see is that it will slow down the epidemic so that other countries in other areas can buy some time to prepare for the epidemic.
I see. I understand, Jennifer, earlier you were at one of the latest hearings on the Congress suggesting about what should be done from the U.S. side about the latest outbreak, coronavirus, and your suggestions as well. How much knowledge and information do you think when you were testifying over there about the people who were in the room, and including those that have been working on the Capitol Hill for decades?
It was hosted by the Committee of the Foreign Affairs. And they invited me about a week before this hearing. They asked me if I would like to testify, and I said, okay, I can provide based on my knowledge about U.S.-China collaborations in the past on epidemic controls, and also maybe talk a little bit about China's management response to this epidemic. So at the time, I think when we get to the Hill, and I have two other witnesses on the same panel, and they are both very wonderful scientists and policymakers. I think altogether we made a strong suggestion to the U.S. government so that they're not only thinking about the social distancing policy, but also think about as a concerted effort to think about how to control the rumors as well as discriminations against Chinese American during this Chinese American or Chinese who are in this country that's been discriminated because of this epidemic.
Earlier, Dr. Bouey, we heard that even some members of the Congress were suggesting, of course that was being laughed off by many, that it was a so-called biological weapon invented by China, the rumor, the virus itself. That was, of course, being even asked to the Chinese ambassador, Cui Tiankai, in the United States. Ambassador brushed it off and saying, are those things believable?
Of course, there are all kinds of speculation and rumors. There are people who are saying that these viruses are coming from some military lab, not of China, maybe in the United States. How can we believe all these crazy things?
You think it's crazy? Where did the virus come from?
Absolutely crazy.
Where did the virus come from?
We still don't know yet. It's probably, according to some initial outcome of the research, probably coming from some animals. But we have to discover more about it.
From an expert's perspective, like you, I'm not talking about whether we are Chinese or American or anywhere, but just from an expert's perspective, what do you make of statements like this and any scientific basis behind the statement at all?
I won't say scientific basis, but maybe from a social science perspective, what we often see is that a parallel to an epidemic of health issues, there are usually another two epidemics. One is the epidemic of rumors, of conspiracy theories. This happens every time when there's a scary epidemic happening.
Social media companies are now faced with another problem: misinformation.
Fake alerts suggesting that Chinese Red Bull, fortune cookies or mee goreng noodles could give you coronavirus. All of those fake.
The coronavirus outbreak has led to complaints about a rise in anti-Chinese sentiment around the world. In France, for example, a regional newspaper has had to apologize for this headline that used the phrase yellow alerts, while scenes like this one you're about to see here are widespread of people appearing to cover their face just because they're sitting next to someone who's Asian.
CNBC is reporting that Lyft and Uber drivers are refusing to pick up passengers with Asian-sounding last names out of fear of the coronavirus, saying it isn't safe to pick up those riders.
As a Chinese American yourself, and also who have been witnessing the evolution this time of this pandemic of discrimination, do you think there's any cure?
Well, the cure is, again, back to the science. I mean, I'm also a scientist, so I think science often is the best defense. So that's why I talked about this. This is a battle between human and a virus. It's between species. It's not between a person to another person. It's not between, a political party versus another political party, and it's not between countries and countries. I think that is one way to think, you know, whichever we fear. You know, I think fear is often very natural to our human instincts. But how to justify whether that instinct is correct or not, we better look for scientific facts. And the other thing is, you know, we cannot ignore some of the geopolitics, or some people really just want to, you know, make rumors or make waves, or, you know,
take advantage of the situation.
Exactly. That may happen too. So I think in that situation, it really needs a society to justify, you know, where we want to go. Right?
Yeah.
So you know, I have to say personally, I'm, you know, living in the United States. I haven't experienced a lot of discrimination, because I think this society is very careful of the racial relationship and about discriminations. So I think I actually benefit from the public's understanding of the harm of racism and discrimination.
We hope this will be another food for thought, at least at this time, what we are experiencing right now. Another question is about collaboration, which you mentioned earlier in your answer. What about the level of collaboration in terms of scientific research, as far as you know, as a scientist, between China and the United States about coronavirus or novel coronavirus, and specifically this time?
Yeah, I feel that unfortunately this time I haven't seen a lot of collaborations. I mean, we are only 6 weeks into the full-blown epidemic. I still have hope that U.S. and Chinese scientists can work together. But I have to say, you know, I've been working in China on HIV preventions since 2005. And I have to say, after SARS, especially started from 2004 to 2005, there was a lot of collaborations of Chinese CDC with not just U.S. but also many other international communities. Myself, I feel that I benefit from that environment, that many people from experts from all over the world work together and helping China to set up the surveillance system and to conduct some of the capacity building. And I have to say, among the scientists, we all respect each other very well. So that's a really great environment for scientists. But that has changed just in the last few years. I feel that especially between U.S. and China, there are definitely some tensions that spill over to the scientific collaborations.
Dr. Bouey, earlier we know at the early time, the Chinese side already put forward to the WHO about the gene data of this novel coronavirus. How much progress, as far as you know, have been made so far in terms of research about the virus, and also come up with relevant research regarding the therapeutic treatment as well as vaccines? Well, we have very mixed messages these days. You know, you hear one message coming up saying, oh, it's coming up right soon, very soon, and the other say, oh, it's not. So there are a lot of mixed information. From your perspective, to what you really know now in terms of the research?
Well, first of all, I really want to congratulate the Chinese scientists who certainly there are, you know, centers or labs, many scientists working together to isolate this new virus very quickly after the public health emergency announcement. And I think it was basically within 7 days they isolated the virus, and then within 11 days after the public announcement, they already sequencing the genomic information and shared with the global platform, on the global platform, so that scientists from many countries can work on it immediately at the same time. So I think that's a great progress, and that helps a couple of things. So one is that it helps cases from other countries all over in other areas that can link directly to this epidemic. Secondly, it helps scientists to monitor the mutation of the virus, because if the virus mutates, it can change the contagiousness, the infectivity, and it can change the virulence of the virus. So far, we have the scientists has been monitoring this virus, and there are not so much changes, which is good news. Good news for the vaccine development too, because the vaccine development really relying on the characteristic of the virus. So talking about the vaccine, it takes at least 2 to 3 months to get to past the animal model and get to the first phase of phase 1 of the testing.
Absolutely.
And phase 1 is really just looking at the whether people can tolerate the vaccine, the toxicity of the vaccine. And then that would take about a couple of months. And then phase 2, which is a larger study, will usually take more time. And once it gets to the phase 3, usually that's when we look at the effectiveness of this vaccine. That needs even larger, bigger clinical trials to conduct the phase 3. And then from phase 3 being approved to production, that's usually really, if the fastest way to do it would be within a year.
Jennifer Huang Bouey, what a pleasure to have you. Thank you for your best wishes also for the Chinese people. Really appreciate it. All the best to you as well.
Thank you.